Using the Biomac bone marrow aspiration catheter for a bone marrow draw from the proximal tibia is remarkably fast and easy with the following steps. Step 1. Remove the Biomac catheter assembly, plunger, and drill adapter from their sterile packaging. Then, securely attach the drill adapter to drill with the magnet tip exposed. Step 2. Leaving the Biomac catheter assembly intact, carefully remove the protective cap and thoroughly coat the catheter shaft with 3 to 5 cc of anticoagulant. Then securely attach the Biomac catheter assembly to the drill adapter on the drill. Step 3. Prep the skin over the proximal tibia using aseptic sterile technique, and if desired, apply local anesthetic to prepped area. Step 4. Palpate and locate the proximal tibia tubercle and identify the medial face. The optimal entry point is approximately 2 finger breadths distal to the joint line and 1 inch medial to the proximal tibia tubercle entry point. Step 5. Using thumb pressure, pull the skin over the desired entry point toward the tubercle. Then, using a sterile number 11 or number 15 blade scalpel, make a small stab incision over the entry point. Step 6. Stretch the skin again to align the stab incision over the desired entry point. Place the Biomac catheter assembly through the stab incision, abutting the trocar tip onto the cortical bone with a slight angle toward the fibular head. Then, utilizing a drill with a speed range of 1,000 to 3,000 RPM, activate the drill and apply gentle, steady pressure until the cortex is penetrated. Caution: control the patient's movement prior to and during Biomac catheter assembly insertion. Step 7. When the cortical wall is penetrated, advance the Biomac assembly an additional 2 to 2.5 centimeters to assure the catheter's fenestrations lie within cancellous bone. Step 8. Remove the trocar from the Biomac catheter assembly by turning the trocar hub counterclockwise 1 1/2 turns and pulling outward. Then insert the Biomac plunger through the catheter hub and seat fully. Slight to medium pressure may be required to fully seat the plunger. Once seated, remove the plunger. Step 9. Attach a syringe to the Luer lock threads on the catheter hub and begin marrow aspiration by gently pulling back on syringe plunger. Slight downward pressure on the catheter will assure its stability. Repeat this step as many times as needed to collect the desired amount of marrow. Hand each marrow-filled syringe to the centrifuge processing technician. Caution: do not pull back on syringe body, as this may destabilize the catheter. Note: each syringe should be preloaded with 5 cc of anticoagulant. Biologic Therapies prefers ACDA. Step 10. When the desired amount of marrow has been obtained, remove the Biomac catheter by applying gentle outward traction while rotating syringe and catheter clockwise. Once the Biomac catheter assembly, plunger, and drill adapter are no longer needed, discard in an appropriate sharps container. Note: the Biomac catheter may also be removed by removing the syringe, securely reattaching the trocar, then applying gentle outward traction while rotating catheter assembly clockwise. The Biomac's power-driven feature and 5 different lengths allow for bone marrow draws throughout the anatomy. In addition to the iliac crest, the proximal tibia, proximal humerus, and calcaneus are now viable sites for marrow aspirations. Biologic Therapies, developing tomorrow's healthcare innovations today.